According to the Surgeon General of the United States, mental health challenges in children, adolescents, and young adults are real and widespread, and there's a youth mental health crisis that was only exacerbated by the COVID-19 pandemic. Even before the pandemic, an alarming number of young people struggled with feelings of helplessness, depression, and thoughts of suicide, and rates have only increased. Every 41 seconds, someone dies by suicide. Suicide is the third leading cause of death for teens and young adults, ages 15 to 24. For every suicide, there's an average of 135 people impacted by the death. And populations with higher rates of suicide include communities of color and members of the LGBTQ+ community. Not only is suicide a part of the mental health crisis, but it's also a public health threat. In September, we observe Suicide Prevention Awareness Month, with September 10th being observed as World Suicide Prevention Day. As practitioners and educators in applied sports psychology, we work very closely with clients who fall within this demographic and who may have suicidal ideation and/or suicidal intent. We have a responsibility to help them get the support and care that they need when they need it. Suicide is preventable, but it will take all of us. What can we as applied sports psychology educators and practitioners do to help with suicide prevention and awareness? Know the number 988. Add it to your phone contacts right now. In July 2022, 988 was designated as the new 3-digit dialing code that will connect callers to the National Suicide Prevention Lifeline, now known as the 988 Suicide and Crisis Lifeline. People can call, text, or chat 988, and they will be connected to trained counselors who are a part of the existing Lifeline network. The Suicide and Crisis Lifeline is available 24 hours a day, 7 days a week. Increase your knowledge by getting additional training. QPR and ASSIST are 2 suicide prevention intervention trainings that will increase your knowledge and also boost your confidence to ask the questions about suicidal ideation, intent, and plan directly, and then refer to the appropriate provider. Listen more than you speak, and use affirming language when you do speak, because words matter in a world where silence, stigma, and shame can make things worse. Instead of, "John is suicidal," say this instead: "John has suicidal thoughts or suicidal ideation," because we do not want to define someone by their experience with suicide. They are more than their suicidal thoughts. The more that we are open and safe in our communication, the more likely it is that people will seek help. According to a biannual survey of adults in the United States, most people report that suicide can be prevented 94% of the time. This is good news. Suicide is a complex issue that can affect everyone, but everyone can play a role in suicide prevention. Remember, learn how to help. Know the number 988 and listen without judgment. As practitioners and educators in applied sports psychology, we can be advocates for suicide awareness and prevention and make a life-saving difference.